Are you experiencing hair loss right now? Hair loss can manifest in different ways, ranging from mild thinning to complete baldness. It can affect people of all ages, genders, and ethnicities. Hair loss can have significant psychological and emotional impacts, affecting one's self-esteem, confidence, and overall quality of life. Hair is made up of a protein called keratin that is produced in hair follicles in the outer layer of skin. As follicles produce new hair cells, old cells are being pushed out through the surface of the skin at the rate of about 6 inches a year. The hair you can see is actually a string of dead keratin cells. The average adult head has about 100,000 to 150,000 hairs and loses up to 100 of them a day. Finding a few stray hairs on your hairbrush is not necessarily cause for alarm. There are several types of hair loss, each with its own causes and characteristics. Some common types of hair loss are: 1. Androgenetic alopecia. Also known as male or female pattern baldness, this is the most common type of hair loss, affecting both men and women. It is typically caused by genetic factors and hormonal changes. 2. Alopecia areata. This is an autoimmune condition in which the body's immune system attacks hair follicles, causing hair loss in patches. 3. Telogen effluvium. This is a temporary form of hair loss that occurs when the body goes through a period of stress, such as a major illness, surgery, or childbirth. It can also be caused by certain medications or changes in hormone levels. 4. Traction alopecia. This type of hair loss is caused by excessive pulling or tension on the hair, often due to tight hairstyles such as braids, cornrows, or ponytails. 5. Trichotillomania. This is a psychological condition in which a person compulsively pulls out their own hair, leading to hair loss. 6. Chemotherapy-induced hair loss. Certain chemotherapy drugs can cause hair loss as a side effect, typically affecting all hair on the body. 7. Scarring alopecia. This is a rare form of hair loss that occurs when hair follicles are destroyed and replaced with scar tissue, often due to injury or certain medical conditions. Signs of hair loss and hair loss conditions vary between men, women, and children. However, people of any age or gender may notice more hair collecting in their hairbrush or in the shower drain. Signs of hair loss and hair conditions in men may include thinning hair on the scalp, a receding hairline, and a horseshoe-shaped pattern that leaves the crown of the head exposed. Hair loss and hair condition sign in women may include general hair thinning, especially at the crown of the head. Signs of hair loss and hair conditions in children and young adults may include sudden loss of patches of hair, complete loss of all hair on the body, patches of broken hairs and incomplete hair loss on the scalp or eyebrows, excessive shedding of hair but not complete baldness, after various illnesses and drug treatments, rapid weight loss, anemia, or stress. Although remedies promising to restore hair to balding heads have been around since ancient times, most men and women with thinning hair can do little to reverse the process. For cosmetic purposes, or after hair loss from surgical or drug treatments, many people turn to wigs, hairpieces, and hair weaving. Some people get tattoos to simulate lost eyebrows and eyelashes. Certain drugs may slow hair loss, and alternative treatments may bolster the health of remaining hair, but no treatment is likely to replace a full head of hair. There are several hair loss treatments available, depending on the type and cause of hair loss. Some people may avail from the following hair loss treatments like minoxidil. This is an over-the-counter medication that is applied topically to the scalp. It has been shown to be effective in treating androgenetic alopecia. Finasteride. This is a prescription medication that is taken orally and is used to treat male pattern baldness. It works by blocking the production of the hormone dihydrotestosterone or DHT, which is a major contributor to hair loss. Hair transplant surgery. This involves taking hair from an area of the scalp where hair is still growing and transplanting it to the balding areas. This is a surgical procedure that requires anesthesia and downtime for recovery. Platelet-rich plasma therapy. This involves injecting a concentrated solution of platelets and growth factors derived from the patient's own blood into the scalp. It has been shown to be effective in treating hair loss. Low-level laser therapy. This involves using a device that emits low-level laser light to stimulate hair growth. It is typically used in conjunction with other hair loss treatments. Scalp micropigmentation. This is a cosmetic procedure that involves tattooing the scalp to give the appearance of hair follicles. Supplements. The hair supplements like Viviscal or Nutrafol has shown success in stimulating hair growth. Can you prevent hair loss? Hair loss can be caused by a variety of factors, including genetics, aging, hormonal changes, poor nutrition, stress, and certain medical conditions. Although you can't reverse natural balding, you can protect hair from damage that may eventually lead to thinning. There are several steps you can take to help prevent hair loss and maintain healthy hair. Just follow these tips. 1. Choose products wisely. Use a basic shampoo designed for your hair type. When curling your hair, choose less damaging sponge rollers. Also, brush using a moderately stiff, natural bristle brush, which is less likely to tear your hair. 2. Avoid harsh hair treatments. Leave your hair its natural color and texture. If that is not an option for you, give hair time to recover between blowouts and chemical treatments. Don't style your hair with tight braids. Excessive heat styling, chemical treatments, and tight hairstyles can all contribute to hair loss. Try to minimize these practices or use them sparingly. 3. Practice good hair hygiene. Keeping your scalp clean and healthy can help prevent hair loss. Use a mild shampoo and conditioner, and avoid overwashing or scrubbing your scalp too hard. 4. Brush properly. Proper hair brushing can do as much for the condition of your hair as any over-the-counter product. Using a proper brush, apply full strokes from the scalp to the tips of your hair to distribute the hair's natural oil. Be gentle, and avoid brushing your hair when wet, when it is especially fragile. It is best to use a wide-toothed comb on wet hair. 5. Manage stress. Stress can contribute to hair loss, so finding ways to manage stress can help prevent hair loss. Exercise, meditation, and deep breathing exercises can all be helpful. If you are experiencing hair loss, it may be helpful to consult with a healthcare professional or a trichologist who is an expert in human hair, from making it look its best, through to treating problems with your hair and scalp. They can also recommend treatments or medications that may help prevent further hair loss. So it's better to consult your doctor first, to rule out any underlying medical conditions that may be causing it and develop a treatment plan that is appropriate for your specific situation.